This healthcare profession that we're in can often result in burnout, where the demands of our work can often leave us drained. But I would argue it can also leave us energized. Instead of it being draining, it can be energizing. Instead of burnout, this work can lead to resiliency and vitality in our work. Jim Finley, who worked with Thomas Merton, wrote a book called The Contemplative Heart. And in a retreat I attended of his, he taught me this about the circles of suffering and making sure that when we're dealing with people who are suffering, that we are standing in our own circle that we define through that which gives our work meaning and purpose. That's going to be a different definition for each one of us, but we need to define it and stand in it. And that is those things in our work or in life that fill our heart, give us energy, make us want to get up in the morning and go to work. The challenge is when often we try and fix people, or we feel like we're a failure if we can't fix them. That's setting us up for burnout because we can't fix everybody. Fix them if you can, but as we all know, that's a rare occurrence. And if we put both of our feet into the patient's circle of suffering, and we abandon that circle which gives our own life meaning and purpose, we are setting ourselves up for burnout. And we start to feel like this donkey. We lose our grounding. And it's interesting, in the burnout literature, we realize that the most important things that influence health and healing in another individual, those most important entities of who we are what we lose first in burnout. Things like compassion, empathy, patience, ability to listen. The last thing to go is our ability to do a surgical procedure or write a prescription. So when we're dealing with another suffering human being and trying to help them as best we can, it is vital that we maintain one foot in that which gives our life and our work meaning. Then hopefully, with time, we'll give permission to our patients to help them step outside their circle of suffering. And we start a dance. And we start dancing together over time through relationship building. And sometimes this dance requires us to lean in, and sometimes it requires us to lean out. And sometimes we're dancing to the blues, and sometimes we're dancing to a fun jazz piece. But we dance. And hopefully with time, our patients will be able to step outside that circle of suffering and start to step into that which gives their life meaning and purpose. And we work on this together. And hopefully we end up in a better place than we were before. Not only our patients, but ourselves. So I'll end with a quote by Jim Finley's mentor, Thomas Merton. He said, "The rush and pressure of modern life are a form of violence. To allow oneself to be carried away by a multitude of conflicting concerns, to surrender to too many demands, to commit oneself to too many projects, to want to help everyone in everything, is to succumb to violence. The frenzy neutralizes our work for peace. It destroys our own inner capacity for peace because it kills the root of inner wisdom, which makes work fruitful." So enjoy the dance.